I've been in practice for more than 25 years. Not a single time have I done a seminar on men's health. Not once. Shame on me. And female seminars, plenty. And so I got to thinking, well, why didn't I do a male seminar? And it's because, frankly, I didn't think anyone would show up. I guess you proved me wrong, so thank you for that. We're going to talk about the male and the health and the kind of health conditions they may encounter that are unique from that of females. We're going to be talking about the disappearance of the male. So we're going to be rather fatalistic for starters. After that, we're going to be we're going to go into the testosterone myth. I've just had it with all the low T ads that you see everywhere. It's like they consider it a condition now. It's not actually a disease. So low T. Then I'm going to go through some strategies to maintain male health. We're going to go through some specific exercises, food, what nutraceuticals I recommend for males. And yes, I'm even going to touch upon relationships. Where the dysfunction often lies in communication, and not that I'm a counselor, but there's some real biological differences that can account for some behavioral differences. So I'd like to explore some of that. And then we're going to go into male-specific conditions. The male-specific conditions are going to be libido, aging, prostate, cancers, those types of things. And I think maybe this is a little bit too much on a plate. We'll see what we can do. I can already see the doctor snickering in the back. He'll never do this, but we'll see what we can accomplish. So, the disappearance of the male. Today's 20-year-old has a sperm count of yesterday's 70-year-old. We're talking just one generation ago. Testosterone levels are declining nationwide by an average of 1 to 2% per year. This is a disaster. And it reminds me of that old saying where a frog will stay in warm water, and as you get it up to a boiling point, right, it never jumps out because, well, it gets used to it. And I mean, that's all the classic experiment. Luckily, I never got to do that, but we all know about that. And this is a little bit like that. It reminds me also a little bit of our rising autism rates. We did a seminar on autism not that long ago. And autism, when I started, was 1 in 22,000. And now it's in as little as 1 in 60. The numbers conflict. They say 1 out of 15 or 20 might have autistic spectrum syndromes, where it's not officially autism, but close. It reminds me of that. And yeah, it hits the news a little bit. But really, what is going on here? Today's male testosterone levels is about half of what it was a generation ago. Now, you'll hear that testosterone is not at all the whole story. It is not. We think it's, oh, this is it, and it's like hormone replacement therapy for women back in the 60s, 70s, and early 80s. That was it. We know that it ran horribly wrong, and the same thing will be said about testosterone, but we'll get to that. If you look at today's male, fatigue, saggy, they're growing what is comically known as man boobs. They're becoming emotional earlier. Their levels of inflammation is like no one's ever seen before. What is happening here? I think we can partially blame our grandmothers. Why? Because 20% of your toxicity comes from your grandma. Another 20% comes from your mom. In utero, the toxins that they were exposed to, whether it's heavy metals, lead, manufactured foods, artificial food colors, just all that stuff, gets stored in fat cells, and during pregnancy goes to the baby. And we're stuck with that. When we are born, we get assaulted by strange bacteria from a hospital. It's the first thing we are exposed to. Our gut gets populated 50% of the time with what we call nosocomial infections, and that is infections from the hospital. And folks, it's with us for life. It will alter our gut function. It changes our genetic expression, this plethora of toxins within us. And every generation, it accumulates more and more and more. The generation below us is going to have even less testosterone and other male hormones than we do. Thus less strength, less oomph, less vitality. And it is the first generation expected to live less long than us in the history of the world, as far as we know. I mean, I take that statistic with a grain of salt, but at least in the immediate history. And of course, there's been exceptions to the rule, like Civil War, altering statistics and that. But in general, generally, the lifespan has been moving up in the last 1,000 years. It's not going to happen for the new generation. And this is because we all have in us a storybook of life. It's called our DNA. And DNA can be read. So look at your DNA as a story that can be read, and it can have a different ending, whatever influence we give it. So your DNA, if you give it the influence of stressors, pesticides, artificial food colors, artificial sweeteners, fast food, things like that, you all know intuitively it can go horribly wrong really quick. Yet your identical twin with exactly the same DNA can be living this fruitful, productive life where they're avoiding certain food groups. They're having great amounts of fat. They're eating their leafy greens. They're in a happy relationship. And that person will look totally, and I mean totally different than their identical brother. Same genes. We have to learn how to speak to our genes. I noticed something very, very interesting today. So I had this dad come in with adopted daughter. And I've been preaching at him to eat differently and this, and no, it's like hitting a wall. It's just not going anywhere. And I noticed today that daughter and dad look almost exactly the same. The same creases in the skin, the same eyes, a little bit sunken. Everything looked the same. And they're not even related genetically. They just live in the same house and are exposed to the same toxins. Isn't that interesting? We kind of see that with husband and wife sometimes too. The couple, I'm not going to mention, but there's I get myself into deep trouble here. But you notice that somebody who's been married for 50 plus years, that they kind of start looking the same body type oftentimes, and it's because they're exposed to the same environment. So we do, I'm starting off rather fatalistic, but I also want to give you this nugget, is that we are given control over our genes, how they express themselves, and we are making about 1 million new cells every 1 or 2 seconds. And if you can change the environment that those new cells are being formed, you can transform yourself. And that's why in our detox sessions, we see a totally different person coming in than entered it, because they made so many more new cells under new conditions. Does that make sense? And you know what? You can do it at any age, because these cells don't stop replicating. At age 90, they are replicating a mile a minute, just like we are when they're 10. Yeah, so that's an important factoid. A little tougher because we have more layers, sure. But that's beside the point. So there's one other case study I want to start with before we dive deep into it. Last week, I met with a patient who hadn't been in for a few years, had engaged in boot camp. And met with Dawn, and over time had transformed herself. And boot camp is, it kind of started out as a joke, that term, but really what it is an anti-inflammatory food plan that we teach. We modify it to fit the patient just right. It takes away the common allergens, it takes away inflammatory foods, pushes the good fats and proteins and leafy vegetables, and make sure your sugar doesn't go up and down too much. So it's really a renewal kind of a diet. And yes, you lose weight with it. So that's the primary reason that most people do it. But I look at it more as a restoring of health kind of a thing. She had transformed herself. Comes back. Says, Doc, I can't even move. I can't do any of the things I want. Everything hurts. and I'm still eating really, really well. Everything is just so well, but I've lost my vitality, that spark, my muscle mass. I'm gaining weight and I can't lose it, and I'm eating less than I ever have. I says, well, that's probably part of the problem. And then I got into digging and says, okay, are you really, really eating well? Says, yeah, I'm eating almost exactly like was taught on boot camp. I said, well, you know, but I do allow myself a little treat because, you know, this is life, and we can't really just keep on abstaining from everything because, you know, then I'm basically a monk. I said, okay. So my ear perks up on that one. So so how are you treating? Well, I allow myself 1 beer a week. Now, I know on the surface that sounds like nothing, absolutely nothing. However, this is a patient who happens to be very sensitive to gluten. And when you activate your inflammatory genes, you are activating the horror story book of life instead of the fairy tale story book of life genetically. And all the inflammatory conditions in your background, grandma, great-grandma, great-great-grandpa, whoever old genes are there, are going to come and visit you. And what's going on now with this patient is that one little treat a week is totally transforming looks, how they feel, vitality, hormone levels, and that one little treat is just totally ruining a life. Totally ruining a life. I know this patient is going to get back on track very quickly because he says, well, I'm avoiding sugar, I'm avoiding dairy, and I'm avoiding, you know, went down the list. And yeah, I'm doing a great job, but what if I could take away that one super inflammatory food for you, because that's what it happens to be for this patient, then maybe we can get a little more moderate on the other ones. Maybe we'll allow a little bit of dairy once in a while. And she goes, how about sugar? Well, yeah, maybe a little bit. Okay, just you know, the negotiation starts. But I just want to do one thing right and have this patient, again, feel what they feel like, have the hormones balanced, and it's amazing what kind of a life you can have. Yeah? So the sagging male is due to environmental influences. It is not so much due to low testosterone. Testosterone is an end result. We have some great, don't you love America? It's got great capitalism, and I'm always amused by it, right? Being from the Netherlands originally, it's like, wow, how do they come up with these ideas? There's lots of these great capitalists. And so I read in Time magazine about this capitalist. He's not a physician, and he's opened up about 60 clinics, and they're called low T clinic. That's all they do, 60 clinics. It's a $7 billion industry. It's unbelievable, and I saw a picture of the reception area. You know, it's got the football jerseys, and it's got the pictures of the motorcycle, and it's just a really manly kind of place. And apparently 80% of the men that walk in get diagnosed with low T, and they immediately get put on injections, which is what they prefer because you can really bill a lot more for that, or on the patch. And that's what they do. And never mind that it might do some other things. They are into symptom management, aren't they? However, this kind of symptom management isn't really doing much because studies have been released just in the last few months that shows that testosterone injections, testosterone patches do not work better than placebo. And that has come as it's a shock that's it's rocking the medical world. How can that be? Well, it's not that difficult to figure that out, folks, because in order to produce testosterone, a cascade of events have to occur. We have to release luteinizing hormone. We have to release follicle-stimulating hormone, gonadotropic-releasing hormone. All these hormones have to be, and signaling agents have to be released in order for that to happen. And it's a choir of events that occurs. And it's the choir of events that gives us our vitality, our spark, our energy, our muscle mass, and yes, aggressiveness at times. Yeah, and one of the end products that we can measure is testosterone. But if testosterone is low, that means all the other ones are defective also. Shouldn't we be worrying about that? What happens when we artificially jack one thing up and forget about the others? You're going to get a tremendous imbalance, just like with hormone replacement therapy with females, which ultimately is proven to be a disaster, because you're looking at an end result. You've got to work on the health, on the entire mechanism, which will then have profound effects on the entire body. So just working on testosterone alone is foolish, it's synthetic, it's going down the wrong road, and has been and will be more and more implicated with increases in certain reproductive cancers, including prostate cancer. I feel it's going to be, excuse me, not getting emotional on you here. It's going to ultimately prove, I think, so this is my opinion now, not science, it's going to result in bone loss, increase arthritides, autoimmune disorders. It's going to be linked by so many things, and it's a shipwreck just waiting to happen. Testosterone supplementation should not be done. You should have to be smarter and think upstream, see what's really going on. There's all kinds of mechanisms of hormone detoxification in place. That's often the problem. We're talking about sulfation. We're talking about a gene called COMT, which is responsible for neurotransmitter modulation. We're talking about something called methylation, which is the breakdown of hormones. When those are defective, inflammatory estrogen starts playing a role in the male body. Hence the changing emotions. They call that the softening of the personality. It's not softening, no, it's defective. And hence the growth right up top here. And hence the decrease in libido, erectile dysfunction, prostatitis, hair loss, prostate cancer. The list goes on and on and on. But ultimately, it's a reduction of energy, a reduction of vitality, reduction even in intelligence, how clear your thinking is. So this is pretty important stuff that we're talking about. And really what we have to do is jumpstart all these detoxification pathways so that the bad estrogen gets gotten rid of, the good estrogen is promoted, because yes, we have good estrogen also, and the whole cascade of events that produces testosterone is restored. That's ultimately what we have to do. So, what are some of the strategies to restore that vitality? One of them is exercise. I'm always amazed. We treat some professional athletes here, and the ones that I've really worked with, yes, we have to measure testosterone, because testosterone doping is not uncommon. And I say doping because when you do dope with testosterone, you do get about a 3-day high. That's why they do it. After that, it's actually destructive for performance. So right before performance, they might dope with testosterone. So we have to watch levels pretty high, because we cannot get our athletes so healthy that their testosterone levels rises above the limits that is legal, right? And I can tell you that we can take a professional athlete from a fairly low 200 to over 600. I've seen that happen in less than 2 months, just by making the athlete healthy. We're always working on these training protocols and this and that, but what happens if you get the athlete truly healthy and do the training programs? Wow, now you've got a combination like there's no tomorrow. And sometimes we have to dial back some of the nutraceuticals to get the testosterone a little bit lower, otherwise they are disqualified. Very interesting to watch. One of the ways we do that is we switch up exercise, and we do that with explosive exercise, okay? So I'm talking exercise now for health purposes, okay? This has nothing to do with triathlons, this has nothing to do with marathons or doing a 5K, right? Or any of those things. That's a whole other topic, and we have a YouTube video on those kind of protocols. I'm talking about health exercise. And you know what? It is shocking how little it takes to be truly healthy and fit. It is absolutely shocking. What you want to do is you want to activate your large muscle groups in a functional way, in other words, in natural motion, in an explosive way, very short, and you want to keep it somewhat varied. And for us males, you got to keep it brain dead, right? Because otherwise it just doesn't get done. So the one that gets some of the biggest results, biggest bang for the buck, time-wise and effort-wise, is the kettlebell. Yeah? I recommend you start out when you do this with a 25 pounder. Okay, this is 25 pounder. Most guys work out at 45. It's not that heavy for the kind of exercise this is. If we can do something called the kettlebell swing, the kettlebell swing activates about 80% of your muscle mass. Remember, 70% of your muscle mass is from here on down. So we can activate that. Ultimately, what this does, it works your triceps, it works your stomach muscles, it works the buttocks and all the leg muscles. So a little bit like doing a glorified squat. And the way the kettlebell swing looks is like this. You go back, and then you snap your legs, and it comes forward. So, boom. See, and it's a deep squat. See how that goes? And you do 3 sets of 10. Done. You just spent 4 or 5 minutes. And yes, you will be out of breath with that. The one thing that you did not exercise, biceps. Which guy doesn't want good biceps, right? So for that, you have to take a free weight. Okay? And you just do the hammer curl. Make sure your head and neck is back when you're doing these. Very, very critical. Yeah? I'm doing them just a little bit fast. 6 seconds is ultimately what you want to do. You want to do 2 sets of 10. And you want to do it at a weight that you can't do a 3rd set. We call that 80 to 85% rep max. So, it means probably starting at, if you haven't done these ever, 30 pounds, you'll end up at 40 or 50. It's amazing how this stimulates growth hormone, and it's amazing how that little bit, every other day, will build muscle, thus build hormones. I always end up with Vega Sport Protein. That's that one. It's for professional athletes. Built by, designed by, for professional athletes. It's the one that I use because it enhances muscle building. You'll not get huge with this. If you want to get to the next level, we have that on a YouTube video. And that YouTube video is fast results for athletes. We did that one in July. If you want another one, there's a 7-minute workout, New York Times. They have an app, and it's really quite terrific as well. So if you get bored, you can do that one. All right. On the opposite days, so you did this one day. Opposite days. What you want to do, push-ups. You know, I'm going to take this jacket off. I'm getting a little warm. I was in the Netherlands a few weeks ago, and visiting one of my colleagues there too. And he looks at me, he says, you know, you look a lot younger than I thought. I said, well, what do you mean? He says, well, I know what it is. It's the fact that you always wear that white jacket on your YouTube videos. He says, you shouldn't wear that thing. So here we go. He's probably watching. Anywho, so what you want to do is do push-ups. Again, 2 sets of 10. Notice how this thing wants to go all over the place. Yeah? I am recruiting massive amounts of muscles just to control it. Including here and here. You're doing so many things all at once. 2 sets of 10. That's it. This is worth more than 150 sit-ups. Why waste that kind of time? I just am recruiting all these muscles all at the same time. Terrific exercise. Then go outside or on your treadmill and do a few sprints. Maybe 7 minutes worth. My favorite amount of sprints is about 4 sprints. Go for a walk, okay, and then you slowly go to a walk, to a run, just kind of warm up, and then boom, you're off for 100 meters. Recover. Do it again. You're spending 10 minutes a day, 5 days a week. I can guarantee you that if you wanted to, you could run a decent 5K without ever having trained for it. Just by doing that. Might be a little sore the next day, but this is for health. This is for hormone balance. This should be incorporated first thing in the morning. Because you know what? If you're going to do it on your day off, or if you're going to do it after work, your chance of still doing it a year later is less than 25%. Statistically, those that do it first thing in the morning, more than 75% of them are still doing it a year later. Because you know what? Nothing got in the way. And it's part of a habit. It's not willpower. In fact, it takes willpower for me to not do it. Does that make sense? So exercise is pretty critical. You could take it up to the next level, and I do. I like to go for a long run or bike ride here and there, but honestly it's more for emotional purposes than it is for actually getting in better shape. Because you can think problems through and it's relaxing, and that's fine. There's no issue with that. I'm talking, this is the minimum required for optimal health. Okay. So, food is the other one. This one is huge. It changes genetic expression very, very rapidly. This patient I was talking about that has got all the lethargy and the fatigue and not enjoying life anymore, all because of 1 beer a week, I know will come back within 1 to 2 months a transformed person. There's no doubt in my mind. Food talks signals to our body. It changes the way we think, the way we look, the way we feel. And if you do it right, it can buy you 2 to 3 hours more per day. Why not do that? People think they're depriving themselves when they're not visiting a place like Applebee's or what have you. Okay, not to pick on one place, but to me, it's just not worth it. And you know what? I am totally enjoying delicious food all the time, non-stop, huge variety that it seems like everybody else is missing out on. Everybody else is held prisoner to addictive foods, and they're not having fun at all. They have to have their fix. How would you like to not crave certain foods? You don't need sugar. In fact, it tastes weird to you. And instead crave a wonderful kale salad that I had yesterday with a few Brussels sprouts and pecans on it, and had this wonderful dressing that we'd made. It was phenomenal. Check it out, Facebook. We put these on there, along with grilled salmon that we'd done some funky things with, and it really wasn't that much work. And it was absolutely delicious. So, but how about for guys that are not willing to put the work into it? I've never met any of those. Well, things get a little hairy at the Boer household sometimes. And 5 kids, ranging 29 to 13. And 13-year-old this morning, we got to get this balloon car ready for some race, and last-minute instructions, and there's some thing going on, and there's all kinds of things just going on. Okay, this should have totally been done Saturday, but apparently something happened. And imagine that, right? And so we didn't quite have the time we normally do to put out a breakfast. Backup system in place. Oftentimes a backup system is pretty crappy. You don't want to go there. It's better to not eat than to eat crap. It really is. I travel a lot, I'm in airports a lot, and I've come to that conclusion, looking for food, I'm just not going to eat. I'll have my water, thanks. Usually you can find an apple somewhere though. Yeah, really, you don't want those bad signals hitting your gene pool. Because all of us have bad genes inside of us. All of us do. Some of us more than others. So, what I do in situations like that, I tend to make smoothies because I can just pour a big glass for everybody. It's quick, it's fast, and the way we do that is I use either water or hemp milk. Make sure you shake it up because it tends to settle. It's got great proteins and fats in it, and it's tasty. I throw in frozen blueberries, a few strawberries. I put in Vega Sport protein. That's a plant-based protein. You don't want to use whey. Okay, that's a whole other story. but a plant-based protein, so throw Vega Sport in there. I throw in some kind of oil, whatever happens to be available. Avocado oil is a great choice, coconut oil, whatever, just throw it in there. And lots of kale or greens, just throw it in there. And then whip it up. There's Vitamix, there's NutriBullet. The mixer I have is Breville, which is like Vitamix for 1/3 the cost. And it whips up into a phenomenally good shake that everybody seems to like. Even my 13-year-old would drink it, and it is incredibly nutritious. And there's your 10-minute breakfast. It didn't take much. You can even throw probiotics in there. You can even throw your vitamin D in there if you wanted to. Yeah, just throw it all in there and done. Now, I'm a preacher of doing meals, togetherness, relaxed. But the reality of life is it doesn't always happen. So you have to have that backup system. You want to go lazier yet? I love using Ultrameal 360. Ultrameal 360 is one of the most published protein powders on the market. It's been published in 7 different clinical journals. It affects anything from blood pressure to inflammatory markers. It really works on your genetics. It works on the apple shape specifically, so insulin resistance. And yes, some of us guys need to really work on that one, so that's an Ultrameal 360 case. And I throw Vega, I use phytoorganics with it. With 1 little scoop is 8 pounds of dehydrated berries and detoxifying fruits and vegetables. So throw that in there, shake it up, boom, done, gone. Easy. Cheaper than flying by McDonald's, isn't it? And it's actually good for you. It's about being smart. It's giving yourself plant nutrients, lots of proteins, and let's not forget fats, because this whole low-fat thing is the other thing that's damaging the males in the United States. One of the worst things that has happened is twofold. One was the establishment of the pyramid back in the 70s. All fat was evil, was thrown out, can't have it because cholesterol might get you. Cholesterol is a good thing. We make our hormones from cholesterol, and it feeds our brain. And it seems like the whole statin industry has gone nuts and have in vain tried to tie cholesterol to heart disease. And the motto is, if you say it enough, people will start believing you. Well, that's essentially what happened. But you go look at the data. There is no evidence for this. This whole cholesterol thing has neutered the male, has making us into babbling fools because our brains are no longer working like they should, has probably caused early onset Alzheimer's, or at the very least memory loss, and for sure depression in many of us. Cholesterol is good. You want cholesterol. You want fats. You want a high-fat diet. In fact, I believe so strongly in that Don does health coaching for us here, right in behind that door there. And we put together a new program called Nourish, which is just a high-fat diet where at least 50% of your calories is made from fat. And people feel great on that. That's fuel. That brings testosterone. That's the other factor that brings testosterone back to level very, very quickly. And yes, we've taken out the inflammatory foods in that program. So, another go-to for food is just yesterday's leftovers. I always grill double. If I'm doing vegetables on the grill, I'm stir frying it or whatever I'm doing, I make double or triple. Throw it in a glass container in the fridge. I always make sure we have greens available. So what you can do is you come home, you're tired, you don't feel like making a meal, but you don't want to go out. That's expensive. You don't know what you're getting. And honestly, I don't think it works. It's made us very unhealthy. Grand Rapids has one of the highest per capita restaurants in the nation. And I don't think it's a statistic that we should be proud of. Grab your greens. So it's mixed kale, baby greens, whatever it is. Throw it on your plate. Grilled salmon that's cold from yesterday's grill. And salmon is so easy to grill, right? Keep the skin on. Put it face up on the grill. When it's ready, you can just scoop it right off, and voila, you've got this masterful looking salmon. Make sure it's wild caught, by the way. And so you just chop a piece of that on there, throw on your olive oil, a little balsamic vinegar, good to go. Fantastic meal. Preparation time, 3 minutes. Inexpensive, good, and just loaded with nutrients that you need. Your detoxification pathways are just humming. So you don't have to be wealthy to eat really, really well. In fact, I am of the belief that on an extremely limited budget, and believe me folks, been there, done that as a graduate student forever, could eat like a king as long as you know which vegetables to pick. Vegetables are cheap. They really are. Some of the proteins can be more expensive, there's no question about it, so you have to be picky and choosy with that. If you want to eat meat, make sure it's grass-fed. It's a huge difference between grass-fed and commercial meat because the fats in them are totally different. The fats in grass-fed meat is actually anti-inflammatory, whereas the regular meat is pro-inflammatory, and you gotta watch it. Watch the cured meats, the chemicals in them are just ridiculously bad for you. Okay. Going to some nutraceuticals that we do for maintenance. Another thing that's really attacking us are plastics. Okay? BPA is only one of many plastics I feel. We know about BPA, it's been studied, we know it really affects testosterone, we know it's estrogenic for us, we know it raises havoc with all of our chemical signals, and not just female, but I think maybe males are maybe even more sensitive to this. And where do we find this BPA? Starbucks. Right? You get your coffee, you get that lid that goes on top of it, loaded with BPA, steam rises, drips wonderful BPA right back into your drink. Welcome to the toxic stew that is a hormone disruptor. How about that plastic lining from canned foods loaded with BPA? Those plates, paper plates you buy, that's slightly shiny, BPA. One of the worst offenders, cash register. Hand you the receipt, one of the highest concentrations known of BPA. Just the cash register receipt. Makes you want to wear a glove to the grocery store, doesn't it? So these are incredible hormone disruptors, and scientists have been working on this. How do we get the detoxification system up and running? And we've been able to put that into the multivitamin called Men's Wellness, where the multiple that's in there along with the fish oil and testosterone support actually gets rid of all these feminizing hormones. It's brilliant. It's the only vitamin on the market that actually has clinical research backing it. Vitamins generally don't have good research behind it when they manufacture it. They're based on, oh, this vitamin A is good, that vitamin E is good, but how about the combination of how it works? There's very few clinical trials on it, so being science-based here at DBC, we try to get as many clinically researched, clinically trialed products out there to our patients, because if there's one thing that really peeves me off, it is this, and that is patients going to a big box store, picking up a vitamin, thinking they're doing themselves good, they're harming themselves, they just wasted the money, and they're feeding some greedy owner. And that is just unethical, because we're talking about people's health here. And the laws are not in place in this country to watch for us, so we gotta do our own homework, don't we? And the way to do the homework is you can't research it all, but you learned trusted sources and then start working with those. And that's what we've done over the past 25 years. So the Men's Foundation is one I use. We also use something very cool called Bliss Fora. And this one I'm kind of excited about. Oh, this was part of the food thing. This is why I got to display. There goes my ADD. Artisan Bistro. We had this designed for us. This is food that you look in our freezer, this high, I just looked this morning, that's why I got this one. This high, 3 rows, and these are all ready-made meals, all organic, wild-caught, allergen-free, so gluten-free, dairy-free. Absolutely delicious. You just shove it in the oven, and in 10 minutes you've got a great meal. And $6 a meal, $7 a meal, something like that. It's cheaper than going out. So that's something that I'm kind of proud of. So, Bliss Fora, it's not here, it doesn't matter. The Bliss Fora is vitamin D Vitamin B, excuse me, I'm withdrawing that. Vitamin B along with SAMe, which used to be used as an antidepressant. It promotes calm, positive moods. Now we know why it works. It works the detoxification pathways that gets rid of all these evil estrogenic, bad dihydroxytestosterone, that's inflammatory testosterone, and enables us to detoxify. Patients that are on it feel alive in about a week. It's like turning on a light bulb. And it's really, it's kind of a crazy thing to watch, to see if you change somebody's chemistry, how all of a sudden their thoughts change, they become more productive, and the male says, well, instead of passive, I'm actually finding my little aggressive, edgy self again. Doc, I'm starting to speed again. That's what one patient told me. And I thought, dial back. But it's, in a way, it's a good sign, isn't it? It's like that maleness is coming out, and before you know it, you're going to see a minivan for sale. So that's that's what we use. And another protein powder, that was bad. But you know, I sometimes wonder, because I pass a minivan, and not that, I mean, I have a large family, so I don't have a particular bias against it, but then I look over, and here's somebody drifting back and forth at 45 miles an hour, where the speed limit is 70, and I look at him, and it's a guy half my age, and I'm thinking, what happened there? Because I know 10 years ago, you were probably driving a Corvette, and now look at you. And I can't help but think that it's probably over-medicated, and hormones are just off, and that aggressive edge is just gone. It's just gone. And to me, that's not a life. It just isn't. You want to have a little bit of this. So what I want to do for this poor old drifting minivan driver is I want to give them something called estrium, which unfortunately the label says it's for premenopause and PMS symptoms. And so I have a very hard time convincing some of my male patients to take this, because they're going to say, okay, this is really going to change me, doc. I get this all the time. And yes, I told them it's going to get rid of the sagginess. It will help with libido. It will help with your overall brain strength. It's just going to give you your spark back, because I'm getting rid of the inflammatory estrogen, so your male hormones can rise to where they need to go again. That's what we use for muscle building with athletes. My athletes take estrium to make sure their muscles get built to where they should be very quickly. So there's the explanation for estrium, which I always have a hard time with. So enough about nutraceuticals. We need to touch the topic of relationships just briefly. And I can already hear the collective groan out there. But it's a necessary one, because one of the most toxic things that affects male health is a bad relationship with their better half. It is amazing how this chronic cortisol secretion, this chronic stress, competes with our hormones, suppresses it, and what you're left with is a fatigued, angry male. For females, it's a fatigued, withdrawn female. Okay, we react differently. And so a good relationship doesn't always have to be a good match. We always think, well, it has to be this magic match. No, it's about understanding each other. And there's some real basic biological differences between us on how our brain operates. It's, first of all, guys, we got to figure out what makes our wives loved. And believe me, it can change from day to day. I used to do the Dutch thing and do what my dad always did. Nice bouquet of flowers every weekend. Just boom, that's what we did. And I still remember my mother just fawning over it and hurrying up and get the beautiful vase. I can just picture a big orange vase and just arranging it just so, boom, there it goes in the fireplace, and we had to all admire it, and ooh, yeah. And my dad would be sitting there, right? So try that with my wife. An hour later, it's still sitting on the counter, drying out. I'm going, okay, Okay, so then I got in the habit, well, I'll bring her flowers and then I'll put it in a vase and cut it up and present it. Yeah, thanks honey, great. Obviously bringing flowers does not really make her feel loved. I'm still bringing her flowers. But there's other things, and sometimes you just got to ask her, what makes you feel loved? And for her, it's something totally different. It's actually making some food for her. Makes her feel loved. So that's what I do. First thing, I provide the tea first thing in the morning and do those things. Great, she glows. Works for one, doesn't work for another. So make sure we have that little thing figured out. The other thing that we are so guilty of, because we're so wired, is we are so solution oriented, aren't we? You come home and, you know, I just had my day and this door squeaking and the kids blah, 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 and you're going, he should be doing his homework and the door should be oiled and blah, blah, blah. That's about the worst thing we can do. You just got to sit down, listen, make sure you look at her, yeah, and listen. That's all that is required at that point. Make sure you do not come up with solutions. I'm sitting there biting my tongue sometimes. Nope, can't do that. And then after a while, of course you have to come up with some solutions, because that's what a male does and ultimately is what is expected from us. But the biggest thing though, I think, is to get a little bit of a biological explanation how stress is differently perceived by our brains. So when a guy is under chronic stress, you can park him in a corner with a paper, perfectly happy, guy under stress, brain shut off. The wife can literally look at him and say, honey, what are you thinking about? Nothing. What just happened there? When a guy is under stress, the blood flow to the cerebral cortex, right here in the front, is diminished dramatically by as much as 70%. Guess what happens to a woman's brain? The exact opposite. You get increased blood flow to that area, which is somewhat agitating, sharpens memory, sharpens the list of things that need to be done right to the foreground, and makes them more active. They have the opposite effect. So if you are, while you're sitting here thinking about nothing, you hear all this clang, 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 and the dishes, bop, 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 and you hear the rapid, right? We all know that noise. It's an uh-oh moment. You've got to listen to that, because we are perceiving stress differently. Yeah, in my household, the kitchen cabinets start clanging a little louder. Just, I've got a real ear for it. Boom, boom, oh, time to get up. And this is an important factoid, to just recognize each other's differences. Because and you know, we're thinking, well, just have a seat, you know, relax, we can do that later. No. You know you're really in trouble when a 20-year-old wrong gets flung at you. You remember how you did this and this and this 20 years ago? And you go, whoa, where did that come from? And it's because their memory is so acute because of that increased blood flow. So understand the physiological difference in stress and how it gets processed. When stress becomes really acute, so we're talking high stress, our hormones kick in, and it's like a guy becomes a superhuman. It is amazing. We can lift cars. We can sprint faster than anybody. We come to clear decisions really quickly, because now all of a sudden our brain just gets flooded. But it takes that extra stress. And it's kind of weird to watch that high stress afflict a female brain, and it goes into overdrive a little bit. So it's like we complement each other, isn't it? It's really neat to watch it happen. But yeah, it's important to work on that relationship a little bit from a biological standpoint also. And that's about as many pointers as you're going to get from me on this topic. So let's hit that famous prostate for a sec. Prostatitis, I am seeing in record volume. I had one come in his late 20s just 2 weeks ago. This is an old man's disease. I'm seeing benign prostatic hypertrophy in 30-year-olds left and right. Just like I'm seeing adult onset diabetes in small kids now. It seems like everything's being shoved back. And why is that? Well, it's the estrogenification of our society, right? Estrogenic compounds everywhere. Our lack of detoxification, which is really affected by our food and lifestyle, and the accumulated toxins, not just from our environment, but from our mothers, right? So we've got all that compounding us, and we have lost the ability to convert testosterone to its innocent compounds. Instead, we convert it to an inflammatory one called dihydroxytestosterone, and that causes prostate cancer. That causes prostate cancer, benign prostatic hypertrophy. It also is behind prostatitis, which is really just inflammation or infection of the prostate. So the way we go to work on these guys is we take away the inflammatory foods. We adjust their low backs, because there's a definite link between low back issues and prostate problems. The two are very closely connected. We, besides teaching them an anti-inflammatory lifestyle, which means pull away gluten, dairy, sugars, artificial foods, get them eating the right foods. Believe me, that's a job with guys. Okay, so sometimes we just hit it one thing at a time. Get them on a higher fat diet and watch the markers go down. The prostate is usually very sensitive. We push them a little bit harder depending on severeness of symptoms. I'll use something called ultraprostogen, which is palmetto, zinc, and other compounds to help prevent this conversion of dihydroxytestosterone. Funny story there. We do a lot of patients out of state, so this was me checking on a patient 3 months after, comes in with very high PSA, very close, I think, precancerous prostate. And his wife picks up the phone. He wasn't available. I says, yeah. She says, you would not believe it. I said, what? She says, not only are his symptoms much better, but his hair's all growing back. I'm going, what? Yeah, he had this male pattern baldness, very profound. And he said, he's definitely growing his hair back. I'm going, let's go through my protocol again. What are we doing? She says, well, I give him 12 ultraprostogens a day. And I go, whoa. That's, I didn't say that. I thought that. I didn't say it. You know, I didn't want to lose her. I says, wow, that appears to be working quite well. Now that things are up and rolling, why don't we dial that back to 4 a day? And let's see if the trend continues. Now, the neat thing, so what happened there is we really got the dihydroxytestosterone out of there. Hair starts regrowing. And yes, we were able to keep it going at just 4 per day. And he noticed things like his vitality, his libido, his muscle mass coming back, and that's because ultraprostogen also has things in it to get rid of estrogen. If I need a turbocharger, I'll add the estrium to it, and indole 3-carbinol, which is essentially a broccoli extract. Why broccoli? Well, broccoli accelerates your detoxification pathways like mad in the liver, especially the hormonal pathways, and we use this for breast cancer, we use this for benign prostatic hypertrophy, we use this for all kinds of hormonal issues. It's amazing how well it works on males and females. Can you eat broccoli instead? Yeah. 1 tablet equals to about 2 cups of broccoli. I generally recommend 4 of these tablets a day, so yeah, 12 cup, I don't know, that's a lot of broccoli. But broccoli is a really good thing. That's why I wanted to say with that. Yeah? So that's one of the things we do with prostate. And there's also, from my hometown in Rotterdam, comes a very powerful anti-inflammatory that's used for prostate cancer. It's undergoing clinical trials now for breast and colon cancer as well, and it's essentially made from hops with some minerals with it. It's called Kappa joint, and we would use that to reduce inflammation that's with prostatitis, and it works better than anything else that I've seen. So that's what we do. Erectile dysfunction often makes the list of complaints, and erectile dysfunction is an incredibly complex topic. It is very stress related. It is somewhat testosterone related. It's more inflammatory related. For some of them, it's vascular related. With diabetes, 38% of males have erectile dysfunction 10 years after the diagnosis of diabetes. So yeah, in some select groups, it is a vascular issue. When it is a vascular issue, these are very not that difficult to treat, honestly. First, you got to get this underlying situation under control. And then we give them something that we use for our heart disease patients, the ones that have angina, which is a closing of the arteries, right? And you have angina pain. So we give them the same thing. It's called Arginine. It's L-arginine. And I have the male drink that before going to bed, an hour before bed, so an hour before intimacy, and a little bit of honey with it because it allows faster absorption, and it's amazing how that fixes erectile dysfunction. Statistically, I think, better than Viagra. Viagra really isn't that great. It made huge news. They must have had this incredible PR machine with Cialis and Viagra to make it happen. I mean, you even see stock cars with it all over the place, right? I mean, the PR program is unbelievable, but its effectiveness is remarkable how little it is. When I started digging into statistics, it's maybe a 10% improvement. I thought, you know, I took it for face value that it helped virtually everybody. Nah. No, it's it is my opinion that this Arginine gets to the root of the problem, clears arteries just like it does for the heart. And honestly, if there's erectile dysfunction that is due to vascular problems, you can bet that there's other plugs in your plumbing in other places, brain, heart, legs, everywhere. So again, it's a systemic problem. But don't forget about the stress hormones, cortisol. Don't forget about your hormone balance, too much or a little estrogen, too much or little testosterone, right? There's that really delicate balance of all these things happening. And if you want to try to figure out what the exact right balance is for you, good luck. And no doctor will be able to do it either. What the doctor will be able to do is give your body the ammunition so it can correct itself. And that's why we here at DBC, practicing functional medicine, have such incredible respect for God's creation because of its ability to correct itself. We don't try to hijack your hormones. We don't try to hijack you. We just try to give you the building blocks and take away things that are obstacles to your health so it can run like it was designed to. That's the big difference between hormone replacement therapy and giving you the building blocks for better health. Because there's a very, very fine balance where one thing is affecting another, and you know what? It changes from minute to minute to minute. I can guarantee you that my hormones right now, as I'm standing there talking to you, is going to be different than an hour from now when I'm relaxing, right? It stands to reason. It has to. And if you're trying to hijack it with artificial synthetic meds that have side effects, you're in for a boatload of trouble. Yeah. Okay. So, libido is one of those that is hugely affected by exercise. It's probably the most powerful weapon, might even trump food. So this explosive exercise is phenomenal for libido. The relationship thing is phenomenal for libido. But there is such a thing as an herb called tribulus, which is really time-honored, has good research behind it. We call it vitality support here, that really works with libido and changes up libido generally within about 2 weeks. We recommend 2 twice a day. It works very well for erectile dysfunction as well, along with that Arginine. How about that aging thing? I see a lot of anti-aging clinics out there lately, and anti-aging certified. My little private pet peeve, actually. I don't think you can stop aging. I think you can really help patients age well. I really do. I often think of my oldest uncle, Ome Jan den Boer, right? It's my Uncle Jan, and he at 95 is fully active. He has lost his vision, but he exercises 2 hours a day because he likes to. He has a stationary bike and he does weights and those types of things. Is the patriarch of the family, has over 150 grandkids and great-grandkids. Yeah, just incredibly large family, and is fully engaged. And you look at him, you go to visit him, rosy cheeks, looks great, right? And even though he can't see, it's always funny because I leave, so yeah, bye Ome Jan, now just stay seated, you know, I'll find my way out. No, he guides me to the front door and he has to wave goodbye as I'm leaving. But what that tells me, he's fully engaged yet, right? And that's the way to be. And he hasn't done anything artificial or weird. No, I take that back. He does do one thing weird, and that is eat a whole onion for breakfast every morning. I actually think it's helped his health immensely. I do. But I'm not going to suggest that. But what I am going to suggest is that you've got to keep your detoxification pathways going. Keep the B vitamins going, like I mentioned in Blissfora, because we need more B vitamins than a few generations ago to keep our genes preaching a good story to us. We've got to make sure that we keep the estrogenic assault that is affecting us away, which is why your multiple vitamin should have anti-estrogenic effects, so to speak. And I often recommend some estrogen for aging males to bring that vitality back, to get rid of some of the accumulated estrogenic compounds that is causing the male to disappear. The male is disappearing as we know it, and I think it is a crisis and we need to reverse it. And I think it's causing a lot of problems in our society economically, from loss of energy, more sickness, loss of productivity, to actually loss of intellectual property. As the male declines in health, it is amazing how brain power declines right with it, willpower declines right with it, and I think it's time to recapture it. And I hope that I've given you some of the tools to recapture it through the exercise, through lifestyle changes, through the cheat meals that I've provided there for you, where you can still have fast food and be healthy, and through proper nutraceutical support to make up for our society and how it impacts us. It's a big deal. Enjoy being a male. I think it's an incredible privilege. I celebrate being a male, let's make it happen. So after that maleness talk, I would love to go question answer. This is actually my favorite part, and I would love to address any questions regarding this topic for the next 10 minutes or so. So is there any questions on anything? Yes.
Where are the supplements available that you mentioned?
The supplements are available in Nature's Remedies. So that's right around the corner, right there. And we have a tower of power, we call it. Those are all the protein powders. I'm on a bit of a mission with protein powders because there is an unbelievable amount of junk out there that are hurting people. It is loaded with pesticides, artificial ingredients. The whey powders tend to be insulinogenic, which means it causes diabetes. Most of it is malabsorbed, stressing the kidneys and liver and causing more toxic situations. And so here's this bodybuilder thinking that they're doing themselves good. The very opposite is happening. I just did a BIA on a 70-year-old who comes in with severe chronic fatigue, and good for him, wants to go back to the mission field, missionary. And so what we're doing is we're just cleaning up his diet, and I'm providing some protein powder for detoxification. It's called Ultra Clear. We did a BIA today, and his muscle mass had grown by 2% in 2 weeks. Now that is a lot of growth that any bodybuilder would be mighty proud of. What did we just do? He was shocked. He said, I didn't exercise, but he said, I can feel it. What's happening here? We are re-nourishing an undernourished body. He's finally absorbing proteins like he should. And his body is just rebuilding himself at 70. And you know what's fun about being 70? You can build muscle almost as fast as when you're 25. It's one of the things that we don't lose. That's kind of fun, isn't it? Yeah. Also, there's one other thing that I wanted to mention about testosterone, if you don't mind. I love cycling. It's a Tour de France fanatic. And it's interesting to watch the statistics of ex-Tour de France champions who do not retire but go into amateur racing. And their performance up through age 65 decreases by less than 1% per year, per decade. So really by age 50, they're still incredibly fast. They're only off 3 or 4% of their peak performance. Now that's enough to knock you out of Tour de France, mind you. But still, they're very good on an amateur level. But what I find interesting, because I saw this study on these ex-champions, their rate of decline in testosterone is non-existent. It just stays the same. So this declining testosterone that we're seeing really is declining health. And I don't know, I thought, I'm being nerdy here, but I think it's interesting. Yeah. Any other questions? Eating this way, having a lifestyle this way is not a life of deprivation. it's a life of getting more and more and more freedom. So you can do the things you want to do, you have the energy you want to do, so that you're happy, healthy, and have a blast in life like God intended us to. Okay? It's so we need to really focus on that instead of that patient that I started with that wants that one beer a week and does totally ruin a life. Right? So let's keep that in mind, because really this lifestyle gives you freedom. It's not at all restricted at all. And I love living this kind of life because you can drive back past some donut shop, Krispy Kreme. And some of you know the story about Krispy Kreme, but one of my sisters from the Netherlands, when she comes from the airport, she sees Krispy Kreme. You have to stop there. Yeah. So I kind of guide her in, and yeah. It's a little like the other day I saw this patient forced to the foods. When I'm off duty, I'm off duty. I'm not going to judge anybody. But I will acknowledge a patient. Hey, how's it going? Well, I'm just thrilled to see them. This patient saw me right in front of the shopping cart like that. Oh my God. My wife caught that. She said, "Did you see that?" Very good job shielding that one. I almost was going to just sit there and engage in conversation. I thought I won't be that mean. Anywho, any other questions? Yes.
Thank you for spending your Monday night out here to do this.
Yeah, no, thanks. I do this with joy, and I consider it a privilege. It's a mission to spread this word. It has many. It's like putting a pebble in a pond and they're being spread, and thank you for allowing me to do that. It's a great passion and calling that I have, that our doctors have. I'm very privileged to work with our doctors who share it. We're on equal footing here with this mission, and it just so happens that I got to be the center of attention today because it's a guy thing and they made me. All right.
Hey, Doc, can you just list a few good fatty fat?
Good fats?
Yeah, good
Okay.
fats. Just briefly.
Seeds. Assuming you don't have allergies to them. Seeds, nuts, oils. And within oils, there's so many of them. Coconut oil, avocado oil, olive oil. You're talking eggs, great fats. We're talking avocados, guacamole. Just loaded up. Butter even, unless you have a severe sensitivity to dairy. But butter's been much maligned, right? But it's got something wonderful in it called conjugated linoleic acid, CLA, which is really anti-inflammatory and helps your insulin receptors on your muscles grow better, so you grow better muscles. Dawn, am I missing anything?
I think you covered it.
Ooh. Yes. Yes.
Dairy. You mentioned butter. What about raw, unpasteurized as
Okay.
opposed to?
Less inflammatory. Part of the inflammatory nature of dairy is what we've done with the cow and what we've done with processing. It has changed the pasteurization, homogenization process, changes the dairy protein to an inflammatory subtype, which is very hard to break down. Even bacteria have a hard time breaking it, because have you noticed that if your milk, your bought milk, goes bad in the fridge, it reeks really, really bad. It's a rotting smell. That's what it does inside your body. It's rotting instead of completely digesting, which creates very putrid byproducts, which just affects you systemically. I remember well, I'm going to sound like old fuddy-duddy, but the milkman in the Netherlands, to this day they do this, they come and bring your dairy products to the doorstep, and you pick it up that morning, and that happens twice a week. I remember so well some of our milk going bad, it's in the glass bottles, and you smell it, and it just smells sour. It's a completely different process. It's fermenting, not rotting. It's becoming literally sour. If you wanted to, you could probably drink it, and it'd be okay for you. And that is the difference in the way we raise our cattle and pasteurize and homogenize. So I don't have as big a beef, no pun intended, with dairy as I do with what we've done with it. Yeah? So when you go to your organic, non-pasteurized, homogenized, it is a lot easier to break down. It is better for you, although you must keep in mind that we are no longer babies. And because we are no longer babies, we have started losing the digestive enzymes to digest milk products. I've worked a lot, all my uncles are farmers, and I remember well, if a calf drank too long by mom, that eventually the calf would start throwing up the milk. And that's because the calf, at a certain age, loses their digestive enzymes for it. We are not that extreme, but we do start losing it. By age 50, we've lost most of them. So, kind of keep that in mind. Any other questions?
What's the difference between digestion and fermentation in this vein?
Fermentation is the action of bacteria on a compound, whereas digestion is a digestive enzyme that goes in and cleaves a molecule into its subcomponents, allowing the body to absorb those subcomponents. So it's a completely different process, isn't it? Because when a bacteria adds on a molecule, other products get produced. And if it happens to be a toxic bacteria, you get toxic molecules. And these toxic molecules can then go systemically and have a systemic inflammatory effect. And if you happen to have a gene that promotes MS and Alzheimer's, guess which genes are going to start talking louder and louder and louder until finally, boom, you got the diagnosis. Did you get that concept? It's kind of an exciting concept because it gives you power and control over your genes. It was always the other way around. Oh, you got this and this gene, therefore you're going to get this disease. No, that is absolute baloney. You actually have been given the ability to control your genes. Any other questions? Yeah? Good. Class dismissed. Thanks for being here.